So today I'll just be highlighting what fertility is. I have a PP, but I don't know. It's another type of computer, so I don't know whether it will work. But I can talk as well. Yeah, I think talking is good as well. So I wanted to ask, and I'll make it a bit interactive, so if I choose on you, please. Yeah. Infertility is, which is what I deal with on a daily basis, is the inability to have a child, and we usually give it a time frame because you could have 2 months is not enough. Usually we say by 1 year, a couple who are together, and you know what I mean by together, yeah. I'm shyer than everybody else here. Yes. Yes. So yeah, for a whole year. Yeah, if it's a year and it hasn't happened, then you need to see a fertility specialist. But we put another caveat to it. So if you're 35 and above and it hasn't happened in 6 months, then we think, okay, there must be a problem, or there might be a problem, and at that age you need to see a fertility specialist. So it's over 35 is 6 months, and under 35 is 1 year. Yeah, so that's the breakdown. I know there's a lot happening in the infertility space. I don't know how many of you do not know somebody, and I'll say do not know somebody who doesn't have a child, and maybe you haven't talked to them and don't know, but usually they are struggling. And I'll tell you, I asked somebody who I know and I've known for a very long while the other day, and I couldn't even imagine that she's not able to get to conceive. So I asked her, why don't you get a child? Because she's this high person in the bank doing really good things, and she has 1 child who is 8 years. And I'm like, what's wrong with you? Can you remove that contraceptive method? Can we move on? Because you're hitting 41. And she's like, I've not had a contraceptive method since the last child. And it shocked me that how many people are struggling, and you have no idea that they're struggling. So I think this talk is for you, and not to poke fingers, or not to, but just to be a bit more sensitive about people, because I thought I was quite insensitive. I'm just joking with a girlfriend, but she's actually struggling, yeah? So please be a bit more sensitive about this topic for other people. Good, so I have a female structure, and that's where I'll start. So we need to know about what makes us get babies. So I'll ask, were there any people who were really good at science and biology? Because I'm going to ask what these structures are, and Maureen is not allowed, and nor are my media team, because we talk about it a lot. So, yeah, who knows what this is? Oh, this one that I'm talking. Good, the president knows. So, yeah. No, these are fallopian tubes, yeah? Yeah, these are the, yeah. Clearly. Yeah, I feel needed. Clearly, thank you for coming. Okay. And what are these? The 2 ovaries. Good. And this structure here? Were you pretending? Were you pretending? Yeah, good. This structure here? Oh, good. Yeah, but we don't say, even in my videos, we say birth canal. So it's the birth canal. Yes. And this is the cervix. So this is the female reproductive system. Note, I don't have a male, because yours is, the female is nice and beautiful. So that's why I brought it. Yeah. So, yes. So this is what all of us need to, females, to conceive, yeah? So what happens, I'll just take you through a little brief about what happens in a female cycle. On the first day of menses, the lining sheds. So what a lot of people think periods are coming from the fallopian tubes or the ovaries. No. The periods come from the lining of the uterus shedding. So when it's shedding, at the same time, your little eggs, which are here, if you can see the ovaries, are preparing to start up. Yeah, and there are hormones from the brain that come and give us a signal that the egg needs to start growing. So it grows, and around the 14th day, for people who have a 28-day cycle, which is most people, the egg will have reached its maximum size and it's going to burst. So when it bursts, the tube is right here. Note they're not stuck to the ovaries, and I guess that's why he was confusing. They're not stuck. The tube comes and picks up the egg that is ready to burst, or that's ovulating, and thereafter it is transported to around here. So if you get lucky that night and sperm is deposited in the birth canal, it will travel up and reach about this part of the tube. And at that point is where fertilization will occur. And then about 8 days later is when you have that embryo, which is what we call it, attached to the back of the uterus. Yeah, and that's implantation. And therefore we say you're pregnant at that point. So it's a really cyclic thing, yeah? And it happens every month for women. So you see, you have 12 times in a year to get pregnant, and most people are pregnant by the 12th month, yeah? So that's the female structure, and that's how we get pregnant. For a male, we have, I want you to imagine, but you can kind of see what it is. We have testicles and a scrotum. So we have 2 testicles and the scrotum that wraps it. And then we have the tubes that take the sperm from the scrotum and take it to the urethra. And therefore, it's deposited in the vaginal, in the birth canal. Yeah? So that's 101 fertility. I mean, you've passed if you've got that. Yeah? So what's affecting our fertility? Why aren't we conceiving? Why are people having more trouble? Why is it more common now? Is it because we're diagnosing it better? Is it because we are more in tune with our health? Anyone have any answers? Yeah.
Stop being suspicious and superstitious.
Superstitious? Okay. Yeah. Well, we haven't, to be honest. I think it's the up market and maybe the middle class, but there's a whole lot of people who still go to mitishamba and who still have even acupuncture, and that's now the upper class, who do some of those techniques. But I think what is happening is that our lifestyle, and I'll say it honestly, lifestyle is our biggest problem, yeah? And for the women who are here, I see young women, so I'm really happy. Please, age is your most important factor. As a woman, by the way, our eggs are perishable. Let nobody tell you, oh, you can have a baby at 50 like Janet Jackson. It just doesn't happen. Yeah, there are things that she did to get that baby, and lots of money that she spent. So for women, when we're born, we have 6 million little eggs. By the time we're hitting puberty, we have 300,000. Yeah, that's how fast our eggs waste. Yeah, so by the time we're 35, we probably have less than 100. So by the time we're 50, we're hitting menopause and there are no eggs. Yeah, so we can't say, okay, I'm young forever. I just want to do my university, get to that level, and we need to be mindful of our age as women, and it's clear cut. And I think this is the biggest thing I fight with my patients, because I have 45-year-olds who come, or I even 56-year-old, and say, you know, I look flawless, my skin, I do yoga, I'm on all these vitamins, I eat green. I mean, even my eggs are green. And I'm like, no, they're not green. Yeah, your eggs are done. Yeah, so let's age. Yeah? So if you have sisters, we need to balance as women. Unfortunately, we have the harder role than men, I think. And I'm sorry, men, whether you're more or less. I do think we have a harder role. We need to balance everything, but we also need to ensure that we balance having a family as well, and do it appropriately by the age of 35, preferably. Yeah, so if who's I would ask. Anyway, the next thing about women is, and lifestyle, is smoking. And lots of us are developing this, you know, it's cool to smoke. Oh, thank you, because I was just going to go to shisha. It's so cool to do shisha nowadays, but we don't know that shisha is worse than a cigarette. Yeah, it's actually worse. It's not filtered. And smoking, people who smoke, one, are more likely to go into menopause 5 years before their counterparts, meaning your eggs are done. And menopause means we're done. So you can imagine what that toxic smoke is doing to your ovaries. Yeah. People who smoke are also more likely to need 3 times more IVF cycles than somebody who doesn't. So it just makes your fertility that much harder. Yeah. So please, if you don't have children, and even if you do, smoking anyway is really bad for your health. It's not cool. Yeah. Another thing is obesity. And obesity ties down to how we are eating and how we are not exercising, everybody being a culprit, including me. We just want to enter our car, reach home, and sit on our couch and eat, yeah? And we must, as women, be careful because all this, it has an influence on our hormones, and therefore it can interfere with our ovulation, yeah? So as women, we need to eat healthy, and we know what healthy is, We know it's not the cakes, it's not the, yeah, it's the fruits, the vegetables, you know, the good food that doesn't taste so good all the time, yeah? But that's what we need to be doing. And we need to be exercising. What's not proven about diet and exercise is how much of it we need, yeah? But I think being a normal BMI for women, if you're a normal BMI, which I don't know how many, maybe these young girls are within the normal BMI, but it's usually 20 to 25. So if you're not within that range, it is usually harder to get pregnant. And I'm not saying this as an absolute for everybody, it's just for some. Some people don't have problems, but that has been shown to affect our fertility. Alcohol, yeah, we're drinking more, yeah, and that also is affecting our egg quality and our ability to conceive faster. So I won't say much about that. Then our sexual habits, yeah, and I think this is important. I've seen some people are now, okay, listening, they've woken up. So our sexual habits really affect us, and I think it's both for male and female, but I'll go to the males in a little while. And this is because we're starting, I mean, I've had clients who have had intercourse at 16, and I'm sure they're 14-year-olds. And I mean, if we're starting at 16, when are we gonna, we're not using condoms most of the time. People don't use condoms, let's just be honest. We're using P2 as women instead because we're scared of pregnancy more than HIV and STIs, which, I mean, it's ridiculous because what's the worst thing for us? It's really those things. I mean, if you got a baby at 16, I mean, you'll live, and life will move on. But we're scared of, I guess, perceptions and everything else. So the biggest killer and the commonest cause for our infertility in this country is tubal disease and tubes being blocked, yeah? And why is this? It's because of STIs, yeah? That means that we got chlamydia, we got gonorrhea, we got TB as well, is also on the rampant, is upward, on the upward trend. So we get this, and they scar our fallopian tubes. And once they scar them, then our eggs can't pass, and neither can the sperm pass, and we're not getting babies, yeah? And it's common. I don't know, I think every day I probably see 2 to 3 patients with tubal disease, which is serious, yeah? So, I mean, I think if you're young or if you have younger siblings, some of you are very old, but it's okay. Or, yeah. Yeah, but anyway, if you're young and living it, yeah, please use a condom. Yeah, we must use condoms or abstain. I like to say abstain, but not everybody is able to. But let's protect our fertility, especially as women. And even for the men, why I said I'll come to the men is your tubes also get blocked, yeah? Yeah, they get blocked just like women, and it's the chlamydia and gonorrhea, yeah, as well. So what happens is the passage of the sperm gets blocked by one of those infections, and what you actually are producing, which most men don't know, is just semen with no sperm, yeah? Yeah. And I think that's, I need to clarify, because a lot of men think, okay, we are okay, you know, something comes out, yeah, no. No. Yeah, so your tubes can also be blocked. So let's protect ourselves. Yeah, sexual habits is a must, yeah? Let's start later and probably with the right person in marriage. Yes?
Sorry, questions?
Okay.
Sorry, we have questions.
Mr. President has spoken. So for the males, you guys are lucky. Nothing, well, not much affects you. You guys have the easier time. But I will say one is that sexual habit thing that affects your fertility. Let me just talk a little bit, about what we find and what affects the males, yeah? Because I said about our ovaries being, having 6 million eggs. For males, you guys are really efficient. Your system produces, like, I've even seen 300 million sperm in, like, 1 ml. Yeah, so it's for you guys, you have efficient systems, you produce a lot, yeah? But what affects, when we have problems, usually it's about the numbers. So we have lower numbers of sperm, which is called oligozoospermia. And usually that's less than 20 million sperm. Yeah. Another thing that we look out for in men is the way they look. For a sperm, you've all seen that sperm picture. It has a head, it has like a body, and then like a tail at the end, yeah, that swims, yeah. So we check that, yeah. And I'll tell you that it's interesting. Men, you just need 4%. Can you imagine? Of those 3 million sperm, only 4% need to be normal. If you have 4% of those 3 million being normal, you're going to get a baby naturally, yeah? So that's it. Then we also look at the way they swim, because some sperm are confused, they swim backwards, but most of them, yeah? No, it's very true, eh? Yeah, but we need sperm to be moving forwards and to be moving fast, yeah? So there's a count we do, and at least 50% of your sperm need to be moving fast and forwards, yeah? So those are the parameters that we as fertility specialists look for men. And what affects these parameters? I think still lifestyle, yeah? So for men, for me, most of the time it's alcohol, for you guys. The drinking, yeah, affects the quality of the sperm in terms of the way they look. And if they look bad, like you can find 2 heads or 2 tails or no head or something. No, I'm serious. This is what we see under the microscope. It's usually toxins, and toxins are alcohol, the smoking, the miraa, shisha, yeah, bangi is becoming common, these cookies things, I don't know, yeah, you know, all these things, yeah, and they're affecting our fertility and producing lower sperm count and sperm that look abnormal. But the amazing thing about you men is that if you reduce and actually stop for 3 to 4 months, I see a change. Usually the sperm come back, and that's because your sperm are produced every 72 days, yeah? You have a new cycle, yeah? So if you remove the toxics for at least 4 months, we usually have better sperm quality for most men, if it was a lifestyle habit. There are men, though, who have genetic issues and therefore will have no sperm at all, yeah? So that's called azoospermia, when we don't find any sperm. Usually it's genetics, or it is that your tubes are blocked because of the STIs, STDs, or sometimes it's unfortunate, and I want to address the women here, that we haven't looked at our young boys, because the testicles are supposed to be outside the body, hanging in the scrotum for a reason. The temperatures are right for sperm production outside the body, yeah? Inside the body and near the body is too hot for the testicles, yeah? That's why they hang. And if you are men who are men and observe, you'll notice that when it's hot, they hang lower, and when it's cold, they go back up, yeah? And it's because they're looking for temperatures that are maximum for them, yeah? Sorry. Yeah. Yeah, so, yeah, so for women, we need to look at our young baby boys, yeah? A lot of people are not, especially in this country, are not privileged to deliver their babies in hospitals. So you find that no pediatrician looked to check that the scrotum were both down. And I have clients who've come at 35 and had no idea that they needed testicles, yeah? So even as you date for the younger, please check, otherwise, yeah. Yeah, no, I'm very serious. We don't, yeah, it's important. And for the mothers, no, it's true. And for the mothers, please check. It's really important that they are both down. And if they're not both down, you need to see a surgeon who can correct that issue, especially before the baby hits 1. Yeah, it has to be done before the baby hits 1 year. Otherwise, the testicles are in the stomach or in the abdominal cavity and they fry, and I mean, it just won't happen. There'll be no sperm at that point, yeah? So that's one of the things. Yeah, and then I think lifestyle also is the obesity as well, and the diet for men, and then the gym guys. I don't know how many of you know that if you are taking testosterone and all those things, your sperms don't happen, Yeah, they don't work, yeah? So bodybuilders who are, you know, taking all those things, they, yeah, also don't produce sperm. So I think we need to balance, Yeah, how built we get. Yeah, but yeah, so those are the causes. That's what's affecting us in large numbers today, yeah? And yeah, so what are we doing about it as a center, and how are we helping people? I'll talk about the foundation first, which Maureen is the secretary of. We started the foundation in 2013. And I think I started because I saw so many couples who are struggling, and I didn't have any money to start my center. It costs a lot. So I just decided, let's do something to help on awareness, because there's a lot we can do in terms of preventative. If people didn't get STIs, STDs, 70% of our reasons for doing IVF cycles would be cancelled, yeah? Because the biggest cause, the biggest reason why we do IVF, I'll tell you what IVF, or test tube babies, I hope you all know what that is because of blocked tubes, yeah? So we can try and prevent it. So we started it with the aim of creating awareness. We started it with the aim of doing some research, because no research is being done in Africa about fertility. There's very, very little, yeah? I can pinpoint. I think we've done 2 studies in our country on fertility, yeah? And we should do a lot more. Yeah, so that's what the foundation is all about. So we do have events all the time. We have our Facebook page, which we teach, or rather we give information so that people can also be aware and come to the hospital earlier. I mean, I don't want to see you at 45 women, really. I'm not going to be helping you much. But if you come I'm so excited when 28-year-olds come, 28-year-olds. Because at 28, we can do a lot, yeah? We have a lot of time, and most of the people will get pregnant and go on to have even 4 children if they want, yeah? But if you come at 45, I'm not doing anything really. Yeah, so what we do at the center is we have different treatment options, and it just depends on what we have. So we have artificial inseminations, which is just like I'm sure all of you did science, so you know how, I'm sure, AI, yeah, it's called AI, yeah? Yeah. And it's the same thing, honestly, yeah? We just take the sperm, we wash it, concentrate it, get the best sperm, and we insert it right here into the uterine cavity at the point where the woman is ovulating, and then, yeah, we see what happens. It is effective, only 15 to 30% higher than other treatments, yeah? And it's usually, we use it for men who have low sperm count and who don't have good swimmers. Basically, they're not swimming. So we're reducing the time and allowing maximum amount of sperm to reach the eggs. So that's IUI. IVF is very technical, but it's also required, and that one is done when we have blocked tubes. It's probably a whole month process where you come and get injections done. And this is mainly done where we don't have tubes or we have poor egg quality and we need to enhance and get as many eggs and fertilize outside the body and reimplant it. So that's IVF. I think you'll ask more questions if you want to know a bit about more IVF, but it's technical. Yeah, so those are the treatment options, and that's what we do at Footsteps to Fertility. And I don't know if my time is up, but it was up a long time ago.
No, it is now.
Okay.
So that the guys ask questions.
Okay. Yeah, so I think I've tried to wrap it up very simply. It's not that simple. I mean, my career is not that simple, but I've wrapped it up. So if you have any questions.
So I'll help with the
Good. So I'll answer the first one for STIs and STDs in terms of gonorrhea and I guess chlamydia. Those are the 2 rampant ones. I'll say that it's unfortunate that these are the STIs and STDs that cause a lot of blockage, yet they're very silent. For a lot of women, you won't even notice that you have chlamydia or gonorrhea. The symptoms are a discharge, and for women, I mean, what's a discharge? You have discharge day in, day out. You're not even sure if it's a normal one or abnormal one. So there's no foul smell, for most cases. Gonorrhea sometimes will give you a yellow, thick discharge with some smell, but most times it doesn't, yeah? So if you're not very observant, it will go unnoticed. For men, I think it's a bit simpler. They have painful urination. So actually men realize and they go and get treated, but they're scared to tell their partners most of the time. No, it's very true, I see it. And that is the biggest problem because I mean, if you're getting gonorrhea, you've been hopping about, and therefore, are you going to tell the woman who might be your wife? I mean, no. So I think that's our biggest problem, that our symptoms are not as easily recognized than as men, yeah? But it does affect our fertility. And as she said, if it's treated early, it's totally correctable, yeah? I've had a client who had, it was gonorrhea, and it was yellow and pussy when we went in to do surgery. And she has 2 babies right now. So if you treat it early, it can be saved, yeah? You can get a baby. Good. I hope I've answered. For TL, that's tubal ligation, which means that we have snipped over here. Yeah, we've actually caused tubal blockage as doctors. And that's when you've had your desired family size, hopefully after 40. Because people who do it too early come back to me at 40 and say, can we reverse? And I'm like, it's very difficult to reverse this. The tubes are very tiny. Yeah, and by the time we really tie them, because nobody wants to be sued, yeah, we really tie them so that you don't come back. Yeah, so to get to untie them is quite difficult. Yeah, I've never seen a reversal that was successful, to be honest. Yeah, yeah. So you need to be very sure that you've had all your babies by the time you're getting a tubal blockage. There are people who have had babies after, and that is probably because it wasn't tied well. There were times we used to put clips, but that clip thing has gone because a lot of people were coming back. Mostly, I'd say 99. There's nothing 100, so I'd say 99. Good, yeah. How do we harvest sperm?
Yes.
Do I really have to go into that? Yeah, good. Yeah, you can let me. Yeah, well, it's really about, yeah, you have to masturbate the sample for us, yeah? Yeah, it's masturbation, but for some people, in fact, today I have someone who's not able to, we'll have to extract them from the testicles. So we can extract them. No, we pull out. We put a needle. Now, we put some local and then we pull out. Yeah, and awake sometimes. It's very unfair, but yeah. Yeah, but if he can't do it, some men, but I think African men, you lie. I'm sorry. Jungu men come and give me a sample in 3 minutes. You guys. Yeah, you lie. But anyway. Yeah, no. Yeah. So about, yeah, now I'll go to her question. For most men or women, I mean, is the problem more a female factor? No, actually fertility affects both equally, very equally. Yeah? We have, it's 30% of couples have a female problem, 30% of couples have a male problem alone, 30% of couples have a male and female together. Yes. And then 10% we have no idea what's going on. Yeah. So it's equal. Good. Reproductive cancers and cervical cancers, and how do that for fertility? It's a good question because now we are having more awareness in terms of cancer, and people are getting diagnosed with cancer earlier in stage 1 and 2, where we can actually do something about it. It depends on what cancer you have, to be honest, and the stage. So if you have an early cancer that probably needs chemotherapy or radiotherapy, that will destroy your ovaries, or even for men, the sperm, because there are drugs that are toxic. And just like you see the hair shedding off, the sperm and the eggs are really, really, fast-growing cells are killed the fast. So you can become infertile after a treatment. So for those people, for women, we can freeze. At our center, we actually do freezing, where we take you through an IVF pseudo cycle and get eggs and freeze them. And those eggs, when you're better and you're okay, we can use them to get a baby. So if it's early. But unfortunately, a lot come in stage 4. And I mean, in stage 4, it becomes ethically even very difficult for us, because if you pass away, really, yeah, so sometimes it depends on stage and what cancer.
So you not mentioned for the guys.
Oh, for the guys, yeah, for the guys we also store, and that's easy. His question, and then we store. Yeah, yeah, full stop. Or inside? Or in the lady? Okay, if it's an artificial insemination, we wash the sperm, remove the semen because we don't need it. It's toxic. And then we put it into that's for an IUI, artificial insemination. We put it inside the uterine cavity. If it's an IVF cycle, there are two ways. We can put them together on a petri dish. It's outside the body. We put them in an incubator that has your temperature, the body temperature, carbon dioxide and oxygen levels, and they meet. And then we replace them 3 to 5 days later at the uterus and see if implantation is going to occur. Yeah. We can also inject. Yeah, very successful. We have many babies and normal babies. And for men who have low counts or there are people who have very, very few sperm, we can actually inject the sperm directly into the egg and help it fertilize. So, and then do the same thing and implant. So those are the two things that we can do. I'll go to the other question about the sexual debut at 16. And I think that's a good question. The only thing I'll add is that our mothers were then with one partner for the rest of their lives. What's happening is we're starting at 16, and then 1 month we're with this guy, then 2 months we're with this guy, and we're finding people who have had 20 sexual partners. You're bound to catch something, along the way. So that's our biggest problem in terms of, I think, early debut. In terms of contraception, contraception is our friend, to be honest. And I always tell women, it is our friend. We should not be scared because we're getting worse things without using it, yeah? The pill is one of my best friends. In between cycles and to balance your hormones, I give women the pill. And it doesn't do anything. The next month we get really good eggs because we've balanced her out, we've shut her ovaries for a month. So the pill is good. I think the one I got, but don't quote me, let me not say what I want to say. There's some, I'm not a fan of Depo for women, because it does delay your fertility. A lot of women who have used the injection, the 3-month injection, have delayed fertility. So that's the one that I really don't like. But everything else, is quite okay. And the reason I say it's your friend is what happens when we don't use contraception? We get pregnant, then we have an abortion. And what happens when you have an abortion? You could get infection. And if you get infection, I've had patients who have no uterine cavity. It's shut because it had so much pus, it came together. You also affect your tubes if the infection goes to the tube. So for me, even if it's a 16-year-old, if you know you're going to have intercourse, just use your contraception plus your condoms. I'm a big fan of condoms because they're the only thing that are preventing the HIV and chlamydia, gonorrhea. Fibroids, and whether they're caused by delay in getting your children. You know, these days we're seeing fibroids in 24-year-olds and huge ones. So it's not really about, yes, we used to say if you have your children late, you definitely have fibroids, but I have 40-year-olds who don't have children and no fibroids. So we're starting to think that there's something hormonal link. We really don't know what causes, but we think it's related to our estrogen and progesterone levels and some genes, because African women have fibroids, a lot. I trained in Belgium, I didn't see fibroids. They don't have fibroids. But us African women have a lot of fibroids. So there's something genetic about us. Maybe we're more stocky, I don't know, and they're healthier, but there's some estrogen factor. So it's not entirely about age. Yes, you're more likely to have if you wait, but we are seeing very young girls now with fibroids. I think they did. One, their diet was better, and then your grandmother had a child at 16, at 18, at 20, and up till 45, yeah? So, yeah, there was no time. Yeah, fibroids, yeah. Our biggest problem is when you're coming at 45 with fibroids, but yes. Good. What's the cost of a general check? The guy at the back. So that's just a semen analysis. It's very simple for you guys. All you have to do is, what he asked, and we get the sample. Yeah. So it's at my clinic, it's 6,000 for your check, because you need to see me, and then you also need to do what you need to do and get, and then we have a look at it under the microscope. Yeah. And that's all you need, most of the time. If you're good, you're good. Yeah. For men. I know, thanks. No, for women, it's a bit more complicated. Women need a lot of tests because all these different parts need investigation. So women, sometimes it goes up to 25,000 because there are many different things that we do to check that you're okay. Yeah. Secondary infertility, the question, I like the question you asked about, I have a baby and then later on I don't. Remember, it's not static, eh? I've had women at 34 who had had children 4 years before and now they have no eggs. Some people go into early menopause, yeah, and that's mostly genetic and other factors, yeah? But it's not your fertility is not guaranteed, eh? You could also have a tubal disease, yeah, later on. You could catch something. You could have fibroids in the cavity that would affect. So there are anything that can affect a first timer can also affect somebody who's already had children. Yeah? And even men, your sperm count could be on the borderline and it gets worse and then now we have no sperm. And your child by then looks like you have seen them, eh? Copyright, so it was your child. Your mama didn't do anything on the side, eh? Yeah. So men also, their sperm count may reduce. Fashion from the president. I don't know. This question keeps coming up and there's no scientific evidence. I'll just say that. Eh? People are saying, oh, you men, you're wearing this, you know, very tight things. But there's no science, especially for the briefs and boxer thing. Nothing whatsoever says that it affects. Eh? I will caution you that it might, I mean, as if you're doing it too much because of the temperatures, but there's no scientific thing that's pointing. So it's all hearsay, I'd say. Yeah, but I mean, as a man, really, I don't know. We need to be in tight things. So azoospermia is the men who don't have sperm and how we help them. So for these men, there are two options. Some people have azoospermia because the tubes are blocked. And if the tubes are blocked, then, you know, we can extract them the way I was saying with a needle and actually extract the sperm. But for other people who it is primary, meaning you were born with no sperm, it's a donor. Usually we use donor sperm to help them. So it's not your genetic child, but it does help in the family because you still stay a unit. Nobody needs to know that that's not your child. So, yeah.
Thank you so much. Round of applause. No. Yeah. No.
Oh, kick. Oh, sorry. Actually, I skipped two. Kick to the balls. That's while you're playing sport. It goes and comes down, yeah? You know what sport. But no. It can, by the way, it can happen during intercourse. Eh? I've had. Yeah? Yes. It is there. So, yeah. So, I'm just getting where it's during sport, yeah? It goes up and comes back down. Or it gets stuck. It gets stuck. Okay. Yeah, it can if you had, what is it called? Yes, a hernia. Thank you. Yeah, I'm trying to make it simple terms. Anyway, yeah, if you had a canal that was not closed at birth, it can get stuck. Usually it doesn't, but the more common thing that happens is that it torses, which means that the blood supply, if you see, they hang and there's blood supply going there. So sometimes what happens is that it goes round and cuts the blood supply. Yeah, that's more what happens with sports injuries and even during intercourse sometimes. So if you don't go to the hospital in time, that testis can die, which is very serious. Yeah, and even riding bikes. Eh? So it's also caution for mothers who have young boys. It happens a lot in about 14 to 20-year-old boys, for some reason. Thank you.
Thanks.